The adage, "Don't look a gift horse in the mouth," refers to defining a horse's age by their teeth. If the gum has receded and the horse is long in the tooth, then it's an old horse. Like an old horse, my teeth and I have been around for a while, and thus I'm always a bit nervous when I drive up to the dentist's office, concerned about what problems they will find. A common but not usually considered cause for teeth trouble is dry mouth. Geriatric dentistry experts say that saliva is a very important and complex fluid and is taken for granted. Without spit, the teeth fall out in short order. The gastrointestinal tract gets in trouble, and the perceived quality of life diminishes significantly. Certain autoimmune conditions can reduce saliva, but more commonly, many medications can also be a culprit. Pills that can cause dry mouth include those used to treat bladder and bowel spasm, nasal congestion, depression, anxiety, psychosis, acne, epilepsy, pain, high blood pressure, diarrhea, asthma, and nausea. Stopping one of these medications might help to prevent teeth trouble, so talk to your doctor if the story fits. Although dry mouth is a challenge for many, fortunately it's not my problem. My dental hygienist said after a thorough look, "Good news, your gums look pretty darn good for a guy 68 years of age, and I see no cavities." My dentist reviewed the x-rays and she said, "You must be regularly cleaning the areas between your teeth. Whatever you're doing, keep it up." It is very important to care for your teeth throughout your life so that gums stay healthy and teeth stay strong to get you through those golden years. Aside from brushing twice a day and twice yearly cleaning and checkups, my efforts started during my 30s by removing food particles at the end of the day with a water jet washing device. It surprises me every night how many pieces of meat, corn, or broccoli can be stuck up in between my teeth. Also, over the last 10 years, I've been using those special disposable toothpick flossing tools that come in a bag, which I place in a spot I notice and can reach into every day. With daily jet washing, making the toothpick floss effort, and avoiding medicine-induced dry mouth, I've been rewarded after all these years. I still have my own chompers, and I'm not quite so long in the tooth as expected. May you also be so blessed.